An estimated 5.6 million children in the United States have food allergies. That's 1 out of every 13 American kids. So many children live their daily life under the anxiety of food allergies. Fear of having an allergic reaction can be significant in restaurants, schools, and even households. We're seeing allergic reactions when eating is always a part of the lives of these children. Even with home-cooked meals, allergic reactions are still a possibility and stays on their mind. The anxieties caused by food allergies detract from quality of life, but there are treatment methods to reduce this.
Allergy immunotherapy is an effective treatment for dealing with food allergies and the anxiety that is caused by them. The process of immunotherapy is a gradual increase in dosing of an allergen through subcutaneous injection or ingestion to make the body become less sensitive to the allergen. This treatment is the only available option that has a disease-modifying potential.
Throughout our presentation, we will be discussing how allergy immunotherapy reduces stress for kids with allergies. The pros and cons of allergy immunotherapy. One of the pros is that it's very successful in treatments, cost-efficient for families in need, covered by most insurances, and safe. Some of the downsides are immunotherapy, or the risks that come with the treatments because of the side effects and dangers. Allergic reactions and anaphylaxis are unlikely, but are both possible outcomes of treatments. Frequent visits are another limitation of this treatment. I'm Jack, and I'm presenting the social lens.
I'm Oliver, presenting the scientific lens.
My name is Will, and I'm presenting the economic lens.
My name is Noah, I'll be doing the futuristic lens.
Allergy avoidance can cause children to feel like outcasts by being forced to sit at the allergy-free table. These tables are often isolated from other tables in the lunchroom and can cause kids to feel excluded. Over 30% of kids with allergies say they have felt or were labeled as different. Avoidance of food allergies can reduce the likelihood of an allergic reaction, but it does nothing to reduce the risk of accidental ingestion. Still, upwards of 30 kids every year report at least one trip to the hospital due to accidental ingestion. Because it's such a real threat, especially in environments outside the home, children and their parents are constantly anxious about accidental exposure. Immunotherapy helps eliminate allergies at the source, allowing kids to be free of their anxiety. So there was this survey where 57 allergic children were enrolled in clinical trials with peanut flour, and it's an experimental immunotherapy. And their parents were given a health-related quality of life questionnaire at 6 months, 12 months, 18 months, and 24-month time points. And the percentages of the health-related quality of life increased at every checkpoint. And at the end of the 24-month, it had increased by 92%. These improvements in immunotherapy and treatments have the ability to lift burdens of family and caregivers, allowing for an easier, more relaxed life.
Now we'll be talking about immunotherapy looking through the scientific lens. When being introduced to a procedure, most people's first impression is whether the treatment is effective or not. The use of immunotherapy to treat food allergies is very effective. One study claimed that over 134 weeks of immunotherapy treatment, 71% of patients experienced significant improvement. This study shows the effectiveness of the procedure. Also, children have a higher success rate in desensitization, since they are younger and more adaptable immune systems. So using this treatment on children makes it more effective than later in their lives. Many parents worry about the safety when considering a treatment, especially when doctors use allergens as a cure. The idea of putting food that kids have been told can kill them in their body causes anxiety. Immunotherapy works by causing a small reaction in the body, but although a small percentage experience a major reaction, it's about 1 in 21,000. This extremely tiny percent of people suffering a major reaction speaks to how safe the treatment is and how parents and kids should not be worried about the procedure. Another example of immunotherapy safety is approval by the Food and Drug Administration. The FDA is a federal administration accountable for the safety of the American public. The FDA has approved Palparizia, which is an allergy shot treatment for the reaction to peanuts. This approval of the world-renowned FDA gives assurance to patients preparing to undergo allergy immunotherapy, they will be able to trust their doctors and not have to stress or worry about their safety.
To measure the effectiveness of allergy immunotherapy, the economics must be examined. A study was done in 2009 that compared the cost of subcutaneous immunotherapy injections to standard drug treatment. The study included 30 patients with at least a 2-year history of allergies. The study calculated that the healthcare cost in clinic visits and prescription medications of the patients. Subcutaneous injections had an 80% cost reduction and annual savings of $830. The data collected in the study showed patients who chose immunotherapy injections over the standard treatment saved money from medical costs. With all the costs of each of the treatments, the large reduction in price showed by the data is supportive for the use of allergy immunotherapy. Another analysis evaluated 12 years of medical data in Florida. The analysis looked at the overall healthcare costs from asthma caused by allergies in patients over a time period of 18 months. Patients who were treated with subcutaneous injections were compared to patients who were not. The average price reduction in healthcare was 38%. Adults had 30% 18-month healthcare reduction, and children had a 42% reduction. The data collected from this analysis showed the evident savings benefit of immunotherapy. Those who spent money in injections had a lower total healthcare cost from their allergies than the people who didn't spend any money on immunotherapy. The cost effectiveness of these treatments is strong evidence to show how immunotherapy has economic benefits for people who use it. Another thing to consider for the effectiveness of allergy immunotherapy is insurance coverage. For treatments to be available to most patients, coverage from health insurance must be available. In the United States, United Health Group, Anthem, H&S, Cigna, and Humana are the most common health insurances. These 5 most common health insurance plans all have a form of coverage for allergy immunotherapy if doctors have determined the treatment plan. This means that the majority of people who are in need of these treatments and of insurance have access to them.
I'll be talking through immunotherapy through the futuristic lens. This bar graph done by Markets and Markets Organization was able to create a graph about the economy in the coming years for immunotherapy. In 2020, there was a price of $163 billion for the immunotherapy market, and by 2025, they are projecting that there should be $274.6 billion, which is a huge increase. By using this graph and being able to look at projections, you can see that immunotherapy will be effective due to the growth of the market driven by increasing adoption of immunotherapy drugs over the years, and the increasing demand for immunotherapy. When also looking to the future for immunotherapy, government resources and funding are very important. This is because immunotherapy is really striving on the funding and resources they've been given. Therefore, immunotherapy is effective if in the future governments and other organizations help fund and provide resources to scientists.
In conclusion, allergy immunotherapy has high success rates, which shows how it is reliable. The treatments are cost effective, which makes them more accessible for children who have food allergies. Markets are projected to grow in the future. These factors show allergy immunotherapy is an effective treatment for dealing with allergies and reducing stress in children. Therefore, immunotherapy is an effective treatment for dealing with food allergies and anxiety caused by them.
Thank you. Round of applause. All right, a couple of questions. Noah, give one specific way your thinking changed as a result of learning about Oliver's findings.
The evidence that Oliver collected through the scientific lens of allergy immunotherapy changed my thinking. Oliver found that 90% of the treatments properly administered were successful. This evidence Oliver provided context for the effectiveness of the treatments. I believed earlier that immunotherapy was a good treatment, but I didn't know how effective it was until Oliver's data was shown. This furthered my conclusion that allergy immunotherapy is effective.
Okay, thank you. Will, what's an example of a compelling argument from one of your peers' individual reports you decided to exclude, and why?
So we decided to exclude one of my compelling arguments about the economics of allergy immunotherapy, and I found that the production of sale of these treatments were profitable to businesses, which was a very compelling argument to show how the treatments are effective. We decided to exclude this, however, because with the limited amount of time, we thought that this argument was less compelling than the rest of the arguments that we included in our presentation, so we chose to include all the other ones over that one.
Okay, thank you. Oliver, what's a way in which your team's resolution makes you think differently about your own individual research?
Our team's resolution that immunotherapy can be used to successfully prevent stress and anxiety in kids over the food allergies made me think differently about my research. When researching to avoid articles about the general population and focus on studies done for kids. For example, I was using a study on people with allergies to walnuts, but all the participants were adults, so I pursued it.
Okay, thank you. Jack, if you had another team member, what other perspectives could they have researched that would have made a useful contribution to your project?
If we had another team member, they would have done research on the historical aspect of children with allergies and dealing with immunotherapy. The history of allergies in kids would be useful to understanding how allergies include stress. And this history would have been useful to measure the treatments and how they've changed over time. And it would be helpful to include that in our conclusion.
Okay, thank you. Another round of applause.